It's looking good, I think. Can you see it now?
Yes, we can see it really well.
Good. So good afternoon, everyone, and thank you for inviting me to be part of this very important workshop. And I'm going to talk about a multi-professional risk assessment method we are currently implementing in Finland. It's called the LASTA method or LASTA-seula method. We have a sort of a second version of this method that we are now implementing. But just first, I'll say a couple of words about our national situation and the work I am currently doing within our Finnish Barnahus project. I know that your first workshop, the previous day, dealt with the Barnahus model. You had excellent presentations regarding that, so I won't be going into detail of how the Barnahus works. But just to give you some context, we have a national Barnahus project that was launched in June 2019 by the Ministry of Social Affairs and Health, and it is coordinated by the Finnish Institute of Health and Welfare, where I work. And we are doing this work with the 5 university hospital districts, which have their own sort of Barnahus units, and they are called Forensic Psychiatry and Psychology Centers for Children and Adolescents here in Finland. But they do their work the way the Barnahus unit should work. They use multi-professional meetings. The premises are child-friendly, and the aim is to prevent secondary victimization as well as use evidence-based methods in investigative phase as well as in treatment phase. But the work I'm going to present to you now, it is sort of complementary to our Barnahus model. So we are doing this implementation of the LASTA risk assessment model as part of our Barnahus project. And it is tied to our larger Barnahus model. So first, a couple of words about how we deal with child maltreatment and violence directed towards children in Finland. All types of violence towards children are prohibited in Finland. It has been so since 1980s. In 1984, all types of violence, including even minor disciplinary actions that contain any type of physical abuse, were prohibited by law. I think we were the second country in the world to include this statement to our criminal law. And the duty to report violence towards children has been made stricter and stricter over the years. And currently the situation is that it is mandatory to report all types of violence to Child Protective Services. And nearly in every case, you also need to make a report to the police. And while we think this is good, we have this sort of zero tolerance policy. This is very taxing to our service providers. So the number of reports made to the Child Protective Services and made to the police regarding violence towards children is increasing. It has increased for decades, and it continues to do so. And we know from victim surveys that this isn't due to increasing amounts of violence directed towards children. It's just that we are more aware of this issue. It is strictly prohibited, and we have a very strict duty to report. So we have a large number of cases. What this means is that we have severe delays in processes. I think this is not unique to the Finnish context. I think many of you can relate. But currently, the average duration from the report to the court verdict is years. It is on average 2 years or more. And of course, this is unacceptably long delay. So we have delays, and the services are struggling to cope with the amount of cases. And while we think that it is good that we have such strict reporting policies, on the other hand, we think that these lengthy pre-trial investigations that are conducted by the police are not always in the child's best interest. In many cases, we think that it would be in the child's best interest, for example, for the family to work more closely with the child protective services. But while the pre-trial investigation is ongoing and the police is involved, it isn't always easy to do so. So these are sort of the problems we are trying to tackle. And for this reason, we think that we need early holistic structured decision-making tools. I do think that these would be beneficial in many countries, but I think, like I explained, we have our own, I think, issues that are tied to our national legislation and the themes I just explained. And I think this is, for that reason, of utmost importance for us just now. And what we try to do, we try to fit together in this structured decision-making process the different kinds of needs that the children have when there is a suspicion of violence or violence that has been substantiated. So there are the care needs, protection needs, treatment needs, and so on. And of course, this idea is also at the heart of the Barnhuus model as well. And on the right, you can see the LASTA form that is part of this model. So we have created this tool to improve information flow and cooperation between different parties already at the earliest stage after the report of abuse has been made. In the next slide, I will explain to you what this tool consists of. But I think an important point to be made here is that this tool should be utilized at the earliest stage, even before the child is interviewed, right after the report of abuse has been made. And like I said, this is meant to be a way to ensure that the best interests of the child are approached from a variety of perspectives, be they traditional, child protection, physical or mental health. So these preliminary assessments, LASTA assessments, utilize this form that was created based on an extensive literature search. So it contains risk factors that we know from a lot of research conducted over the years that it increases the risk of child being abused, either physically or sexually or emotionally. It includes items related to the child characteristics, for example, whether the child has some sort of somatic illness or suffers from developmental delays or has a diagnosis of conduct disorder, for example. These are items that we would be interested in when conducting this assessment. It includes items related to family characteristics, for example, whether the parent has a mental or substance abuse disorder that might be related to risk of abuse. It also includes items related to prior service use, for example, whether the family has been involved with child protective services before or has been involved in abuse assessments within the police before, whether there has been calls made to police regarding domestic abuse, things like that, or whether there have been suspicious injuries, whether there are fractures or unexplained accidents that you can see from the child's healthcare records that could be sort of red flags if we think about the risk of abuse. And this information is collected from police files, child protective records, and healthcare records. And it is collected by the Barnhuus staff or a specifically appointed LASTA coordinator in some areas. And in many cases, after the information has been collected and after the form has been filled out, this knowledge is utilized in a multi-agency meeting where police, prosecutor, and healthcare and child protective services jointly make decisions. And these decisions might involve issues such as when it is best, for example, to send a child to be interviewed in a Barnahus center by a forensic psychologist, or when can perhaps police conduct an interview. In Finland, both of these parties can be involved in interviewing the child. Also, what can be discussed is it best to cease the pretrial investigation and instead let the Child Protective Services take the lead? For example, if we have a parent who is actively seeking help after, for example, once pulling a child's hair after being exhausted or something like that, and there are no risk markers in the records, it might be decided that in this particular case, it is best that Child Protective Services take the lead, and the lengthy pretrial investigation involving the police, it's not the best way to move forward. And also decisions can be made of what kind of support to give for the child and family. And of course, in some cases, this might involve, in acute severe cases, for example, placing the children in outside care, for example. The form is quite long. It is, I think, currently a bit too long. It's 4 pages, and this has caused some issues on the field. Some professionals say that they don't have time to gather all this information, or they want to amend it, make it a bit different. We are trying to be flexible, but on the other hand, we feel that we also need a way to collect national data on how this model is used and what kind of information is gathered. I think from a research standpoint and from the point of view of developing our services, I think it's important that we have a flexible but still structured enough system. And well, I already explained about the items. Here are some examples. For example, one item relates to possible recurring absences from healthcare visits. In Finland, we have a healthcare system where the great majority of children visit a nurse at least yearly. And we know that being absent from these meetings or not going to the dentist, for example, in some cases, it might be a signal of something being wrong with the child and the family. Another example item, does the parent have a positive attitude towards physical punishment in the upbringing of their children? And of course, it needs to be specified where this information comes from. Whether there have been child protective services, emergency home visits, and so on. And after this background information is gathered, like I said, decisions are made. For example, regarding the need to have a physical somatic examination of the child and whether it needs to be urgent. So just some examples, and yes, then a summary, what we think of this work now. We are implementing this, and it seems to improve the information flow between different authorities. Like the previous presenter said, we also have a very shattered system, and I think this is one way to tackle that problem. On the other hand, we only have this limited experience, and I think we definitely need some validation studies on how this model actually works. We need to conduct scientific research before we can be sure that this actually is helpful for the children and for the professionals. But already now in some cities and some areas of Finland, this has become normal practice in cases of suspected child abuse. Not all of these areas use this LASTA form as we as such. Some have modifications, but the basics are the same. They go through the information from the healthcare files, from the Child Protective Services files, from the police files, go through the risk factors, and then make joint decisions. And we think that it supports both the police and the prosecutor in making better informed decisions regarding the investigation, but it also supports a more nuanced assessment of the needs of the child in terms of protection and care and treatment. However, we do have some remaining problems with the implementation. And one of them is that there are some legislative barriers which hinder the scaling up for this practice. For example, sharing the child's healthcare records and information derived from healthcare records is not always possible in every case. While we think that this information is quite vital when we try to make risk assessment or structured judgments. And so this is something we need to tackle, and also collecting the information takes time, it takes resources. So if we want to scale this up on a national level so that this would be available for most cases of abuse, we would need definitely quite a lot of new resources. But thank you. This was the end of my presentation.